see if I can get you community center or something.
5:15.
On a newborn's head, the nurse notes a swelling of the scalp that does not cross the suture line. What is this finding? Okay,
I
so
totally
if it does
guess.
not cross the suture line, so we have, there's the suture lines, right? There's the different bones in the head. And if it crosses the suture lines, it's superficial. And that's caput cicadium, caput like a cap that you wear. Okay, if it doesn't cross a suture line, it's deeper. And that is, you're going to be your cephalohematoma. And that's a
Okay.
collection of blood. Okay. Which of the following actions would be least effective in maintaining a neutral thermal environment for the newborn? Yeah, that's the least drafty. The newborn axillary temp is 96 degrees Fahrenheit. His lower lip is shaking and his hands shake with Moro reflex. What's the first thing we should do? Good. All right. Hypoglycemia and hypothermia go together. So we've got tremors, we've got low temp. We need to check the glucose. Which of the following actions demonstrates the nurse's understanding of the temperature, the newborn's thermoregulatory ability? That one seems a little obvious. I didn't write the question.
Come here.
Read it one more. What's the nurse's best response to a mother who's voicing concern about the molding of her 2-day-old infant? Yeah, normal. All those bones shift and make the baby fit. What symptom assessed in the newborn shortly after delivery should be reported? Good. Cyanosis of the hands and feet, what's that?
Normal.
That's normal,
Nobody-
isn't it?
Yeah, what's it called?
Don't remember.
Okay, it's called acrocyanosis, and it is normal.
Okay.
Okay. Everything else on here is normal. Retractions is a sign of respiratory distress. When the newborn's crib was bumped, the nurse noticed that his legs flexed and arms fanned out. What is this behavior? Yep, or reflex. We call it the startle reflex. Which neonatal reflex would the nurse teach the mother to elicit to facilitate breastfeeding?
Ooh. Mm.
Okay. When you're trying to get the baby to latch, you can stroke their cheek and they'll open and turn so they can get their mouth on the nipple. That's that rooting reflex.
Okay.
What will the nurse expect when assessing the anterior fontanelle of a healthy full-term newborn? Okay. So we would expect it to be open and diamond shaped. What would be a concerning finding?
If
The
it wasn't
sunken in.
there, oh, sunken in,
Okay, if it was sunken in, what are we worried about?
dehydration,
Okay, what if it was bulging?
bleeding,
Something, increased cranial pressure, something in the head that's putting pressure in there. Which statement indicates the parents understand the guidelines for bathing a newborn? Okay. This one wants you to shampoo the head after washing the rest of the body. Why is that a good idea?
because we hold heat in there.
Mhm. Yep. So you want to wash the head last because and then get them all bundled and dried off because that's where they're going to lose most of their heat.
Okay.
The nurse is measuring the vital signs of a full-term newborn. Which finding is abnormal?
I'm guessing.
Okay, do you know what the normal ranges are?
Is it 140 to 160 when they're first born?
For their pulse?
Yeah.
It can be as low as 120, yeah, but yeah, to 160. So similar to in utero for the heart.
Okay. Okay.
It's normal respiratory rate.
Is it like 40 to 60
Yep,
or 30 to 50?
40 to 60.
Okay.
Okay. And that's an important one because a lot of the things that we worry about with babies has to do with respiratory distress. And if they're breathing too fast or they're tachypnic, that's a clue. All right. And then normal temperature is going to be similar to ours, and we don't really do baby blood pressures. The nurse is caring for a breastfed newborn. What will the nurse expect the stool color to be 2 days after birth? Two days after.
Oh,
So
I need to study newborn more.
well, what is black and tarry?
That's the meconium. That's when they first start having a bowel movement.
Yeah. And then as
Okay.
it transitions, when do we normally see yellow?
It's when they're breastfed. It's like a yellow clay color.
Yeah. And it
Oh,
can look seedy. Yep, it's yellow.
you're rocking it out, Nikki.
The full
Hey,
term newborn
don't teach
weighs
me.
3,600 grams at birth. What would the nurse expect the newborn to weigh in grams 3 days later?
Hmm.
I'm guessing.
We want them not to lose more than 10%. Okay, so this one, 3,800 is gain, and we're not going to anticipate that they're going to gain in those first 3 days. These other two are going to be, if you just do a quick math at a glance, that's going to be too much weight loss. This is going to be pretty close.
I was looking at the 3 grams. It's been a long day.
Weight in grams 3 days later.
Yeah, so I was looking at the other side.
Parents ask about their newborn girl's vaginal discharge, which appears to be bloody mucus. What is the probable cause? It's going to be the estrogen from mom.
I didn't even get my answer in.
I saw your face, so you're like,
Yeah, I was like, mm.
which statement indicates the parents understand when to contact the pediatrician? Okay, sign of dehydration. How many wet diapers should they have a day?
10.
I was gonna say 8 to 10.
20.
4,012.
My kids are grown now. I don't remember.
Parents ask about the milia on the nose of their infant. What is the nurse's most helpful response? Yeah, we're gonna leave it alone. I remember that with my youngest one. It looked like tiny pimples. And
Mhm.
you want to get the little white things out of them. You need to just leave it alone. It'll go. And that's what the pediatrician told me. Leave it alone. The nurse is using a bulb syringe to clear mucus from a newborn's nose and mouth. What is the nurse's first action? Okay, so we don't want to squeeze the bulb after we've put it in their nose or mouth because we're going to push whatever we're trying to suck out in, right? Because when you depress the bulb, you're pushing air out of it. So we're going to depress the bulb, then put it in, and then let go, and it'll suck.
That makes sense. I think my brain's shutting down.
You're like, I'm done.
I'm tired.
Do you know which one we suction first?
We do the mouth first, right?
Mouth first, okay? Because babies are obligatory nose breathers. So if we go to suction the nose first, they'll and suck in whatever they've got in their mouth. What action does the nurse implement to protect newborns from infection while in the nursery?
I think I can handle this question.
It seems like that is the way to go. Wash your hands before you touch other babies. Parents of a newborn ask about dark areas over the scrotum of the newborn. What does the nurse explain this is called? It's over the sacrum, not the scrotum. Mongolian spots. Apparently I'm tired now too.
I'm rubbing off on you.
Yeah, it's contagious. The nurse in the nursery may use cries, pips, nips, or MPAS as a guide to assess for what? Yep, those are all pain assessments. The nurse teaches that when the neonate stool becomes loose and a greenish yellow color, this is what type of stool? So this is your transitional stool. So we had black and tarry. And in our breastfed baby, we're gonna go to yellow and seedy. Greenish yellow and looser is transitioning between the two.
Okay.
The nurse is teaching parents of a child with a cleft palate. What will the nurse instruct to report immediately?
Oh,
I had no idea.
Yeah,
I didn't either.
well, the cleft palate's up here, and if we've got milk backing up, then it can cause ear infection.
Okay.
When bathing an infant, what sign does the nurse recognize as a sign of developmental hip dysplasia? Good. The nurse is caring for an Rh negative mother on postpartum. What indicates the need for RhoGAM for this patient? Good. Rh positive baby, Rh negative mama. Parents ask the nursery staff what the light does for their jaundiced infant. What is the nurse's best response? Perfect. We're breaking down the bilirubin so they can excrete it. How do babies excrete it?
Urine.
Yeah, good guess, but no.
The stool.
Cool.
Good. But we got to break it down for them to be able to excrete it through their feces. So we want them eating, and we're using the Billy lights to break it down.
Dang, Nikki.
Phototherapy is started for an infant. What's the most appropriate nursing action for the infant having phototherapy? Yep, cover the eyes. They have cute little ones. They look like sunglasses. They're like pads, but then they have sunglasses drawn on them.
Oh.
The nurse is caring for a macrosomic newborn whose mother has diabetes. What should the nurse assess for? Hypoglycemia. What assessment made by the nurse would lead the nurse to suspect hip dysplasia? So this is going to be asymmetrical gluteal folds. Okay, so if you look at their,
Makes sense.
you stand them up and you look at their high knees, instead of being symmetric, they're off kilter.
That makes sense.
Mhm. The nurse is providing care for a child with Down syndrome. What body system has the greatest risk for congenital anomaly?
I answered, but I think I answered wrong. Yep.
Yeah,
They
I
all
was
have heart
guessing.
problems.
Yeah.
Yeah.
After I
didn't know
answered
that.
it, I was like, ah.
You're like, I knew it was heart. Yep. Cardiovascular. The parents of a child diagnosed with cystic fibrosis asks the nurse what caused this disorder. What is the response?
I'm guessing.
It's a metabolic defect.
I guess too.
Yeah. Well, you're the man, Nikki.
Yeah, I can do it on here, but don't ask me to take a test and score good.
You're fine. Good job.